All right, Dr. Allgood, we're online, sir. And listen, I'm extremely excited to speak with you. And I have so many questions that will not push past the 40-minute mark. I promise you that. But again, I can appreciate how busy you are. And thank you for taking the time, sir.
Oh, my pleasure, Samir. Thanks for having me.
So I want to give you a brief background on what this is. This is our quarterly simulcast that we're calling the Wash Up. And as part of its constitution, we like to bring on guests who can speak to two main concepts, and that is sustainability and also WASH as well, and the importance of WASH in today's circumstances. You fit the bill. You need very little introduction, sir. Dr. Allgood has been a WASH industry veteran for a long, long time, and he will certainly touch on his expertise and experience. Dr. Allgood, if I may give you, I believe our audience resonates with certain core aspects of our mission, particularly the sustainability and environmental approach that we take with regards to international development and WASH. We're very proud of the work that we do at EcoSoap, including the sustainable employment of women, the sustainable recycling of soap, and of course, the redistribution of hygiene to communities abroad. Now listen, to commemorate World Water Week, we have invited you on to speak with regards to water issues, but also to educate us on hygiene as well. Hygiene does not live in a bubble. It requires water as well. And so we're very grateful to have you on today.
Thank you. And I'm so encouraged that we're already starting to work together. And I love the fact that we're showing visibly that NGOs can work together. And we're working together in Cambodia with Bradford Soapworks, and it's a great model. I hope we can expand it.
And we'll certainly touch on that too. So the real reason why we started this, sir, is I was having, over the last 5-6 years, I was having some of the most exciting and illuminating conversations with leaders such as yourselves. And I wanted to provide an audience with a glimpse as to the quality and the caliber of those conversations, the exchanges of ideas, but also heartfelt stories from the field and directly on the people that we serve. And so I kind of want to start there today. If I may ask, was there a singular moment where the importance of water connected for you? What country was it in, and at what time point was it in as well?
Yeah, well, I'm a water person. I know I've been influenced to be in love with water all my life. So I could go back to watching Jacques Cousteau, and I became a scuba diver. My family's all scuba divers. But for the role that water has to do in eliminating poverty and addressing health and women's empowerment, while I knew about it academically because of my studies at the University of North Carolina, when it really hit me was I worked for Procter & Gamble for 27 years, and I created their Children's Safe Drinking Water program that still is going strong and provides more than 1 billion liters of water every year. Wow. And it was very early days in that program. We had yet to provide anything close to 1 billion liters. And in fact, the program was in jeopardy. And I was in a part of Western Kenya where it's pretty close to Lake Victoria, but not close enough that people could get water out of Lake Victoria. And if you dig down, you get salty water. And so people rely on these shallow ponds that they dig with shovels, even sometimes by hand, and they fill up in the rainy season, and you hope and pray that it's going to last through the dry season. And so it's the only source of water. So, for cattle, goats, washing, cleaning, even drinking. And the PNG product was a water purification packet. And we took a woman's water, who was standing beside it collecting water, and we added the packet and cleaned the water. And then we just had a conversation. I was there with some potential donors to the program. People had gathered to watch us, like happens when you're in the field.
Sure.
And one man who was standing off to the side the whole time, he saw this bucket of crystal clear, clean water in this area where there is no clean water. And as we walked down to the side of the little pond, he picked up the bucket of water and he ran away. He stole it.
Okay.
And before I left, the woman whose bucket we had used to clean the water, she so wanted those water purification packets, she got down on her hands and knees and begged me for them. And of course, I gave her the ones I had left. And so it really hit home that this is a matter of life and death, the global water crisis. People are willing to steal and beg because it's a source of life. And that was a profound experience that really gave me the courage to make sure that program did continue and did become one of the largest efforts by the private sector to solve the global water crisis.
That is absolutely sensational. It is these sorts of stories and direct experiences which provide people in privileged leadership positions, such as yourself and myself. We metabolize those stories. I would imagine, sir, that you continually remember those instances, and that drives you to want to reach more people with clean water each and every day. I have had similar experiences as well. And it's kind of the visualization that I wake up with every single morning. Listen, I think we have made so much progress in terms of clean water, and it really is the bedrock of anti-poverty efforts and basic human dignity efforts as well. It has been reinforced with books such as Factual and Enlightenment Now and others that we have made significant progress in this world addressing this crisis. Before we speak to the gaps in the crisis, can you touch on what World Vision has accomplished to date, both under your leadership and beyond?
Yeah, sure. It is, the media doesn't cover good news. That's not their job.
Right.
So it's, people are always surprised to hear what enormous strides that have been made in global health and whether it's maternal health, but in water specifically, since 2000, the global community has reached 2 billion people with clean water access, 2 billion. Now we still have 785 million left to reach, but that just shows you that this is something we can accomplish. Solving the global water crisis is definitely within our grasp. And, I joined World Vision 7 years ago. I had been a donor partner to them when I was at Procter & Gamble, and I had a chance to take early retirement. I was sort of working with everybody in the water sector, but I only placed one call. And that's because I really love World Vision's model to solve poverty. And it really all starts with providing clean water. So I joined 7 years ago. I've been in a blessed position to help lead our strategy. We've tripled in the amount of people that have been able to reach in the last 7 years. And we now reach one new person with clean water access every 10 seconds. One new person every 10 seconds, which is sort of mind-blowing. And the reason we focus on that is we looked at our footprint. We're the largest Christian relief development organization on the planet, partnering with local governments, local NGOs, other groups like yourselves. And we looked at our footprint as the largest NGO in the developing world and said, what would it take to reach everybody, everywhere we work, every man, woman, child? And our estimate is about 50 million people. And we did this assessment in 2015 when the sustainable goals were set out. And so we made a commitment to reach everybody and to reach those 50 million people by 2030, consistent with the sustainable development goals. But that was seemed like a really long time out. We made it, not so far now. So we set this interim goal to reach 20 million people by 2020 in 2016. We're now 4.5 years in, and we've reached 17 million people with clean water access for the very first time. And if we continue at the rate of a person every 10 seconds, we will achieve this goal of reaching everybody everywhere we work.
It's remarkable. Can you break down what I'm always aware, please, it's not a criticism. I'm always aware of myself overusing jargon. And can you break down specifically in a community visualization what access means? And for us in the West, access means going to our sinks, going to our taps. However, the transformation of not having to trek several kilometers to an access point for reliable water, that is absolutely transformational. So what does access to clean water in World Vision's objectives actually mean?
Yeah, that's a great question. So first, let's break it down what it would look like. And World Vision focuses on the toughest to reach places, which typically, eight out of 10 people who don't have clean water access are in not urban places. Although there's this great shift to urban areas, still the need for clean water, basic access is still much higher in the rural areas, and certainly the deaths from diarrhea caused by unsafe water, poor sanitation, hygiene. We're able to have a long-term presence in these communities because we also happen to be not only the largest not-for-profit provider of clean water, but also the largest child sponsorship organization. So that allows us to have a deep presence in these rural communities. Then we'll work with those communities from day one, from the first handshake, to make sure they own anything that's provided, that they're going to be making the decisions. We're going to be sort of a technical assistance to them to accomplish what needs to be done. And even whether we need to provide water in that community. About 50% of the places, about half the places we work in, will prioritize having clean water.
Sure.
And they'll know that they need clean water because they may be walking the women and children hours for clean water every day, hours. And they don't get a day off because if you don't go for water, then you're not able to cook. Your kids can't eat. You don't have anything to drink. And so we provide clean water access within 30-minute round trip, including any waiting time. We also help them have improved sanitation and hygiene because it's that whole package together that addresses illness. And it's not only so that people have clean water access near their homes. Half the schools in the areas we work will not have clean water. And it's even worse situation for hygiene in the healthcare facilities. So we'll reach water near people's homes, directly into the schools and directly into the healthcare facilities in order to provide a comprehensive approach to water sanitation hygiene. In the 7 years since I've been with World Vision, our teams have had a real shift in the way that water is delivered. Okay. In the past, 95% of the times, it was a borehole through a large drilling rig with a hand pump. That's only 5% of what we do now. So it's completely reversed. And now it's whatever is most sustainable, most cost-effective, most applicable to that local hydrology. Many times now, it still is a borehole, but it will be a solar-powered system. So we'll put in a submersible pump. We have a wonderful partnership with the largest submersible pump manufacturers in the world, Grundfos. We'll put in a submersible pump in the borehole, have an overhead array of solar panels that pump the water up into an overhead storage tank. And then there'll be pipelines throughout the community so that the water goes directly into the healthcare clinic, directly into the schools, and in multiple collection points throughout the community. And some households may then decide to pay additional to have even household water connections, to have, the ultimate aspirational target for most people is to have just what we have, pipe treated water directly into their homes.
I appreciate the long-term approach here and that has been undertaken. If an organization wanted to grow and maximize its impact, it may stop short of what is the long-term and sustainable solution that needs to be thought out and needs to be decided by local leadership. And that's I'm a big fan, if you haven't noticed already, one of the reasons why I resonate so much with World Vision's model and constitution, if you will, is because it seems, and as a layperson, it seems that most of these decisions, most of these sustainable strategies are being defined by local leaders in the country, such that we are not perhaps exporting ideas from the West or something like that. Could you please speak to that note briefly, if you would?
Yeah, so World Vision's leadership a long time ago decided that we needed to have local leaders within the organization, and we needed to have a community development model that built on local leaders. So not, and I'll come back to that, but for the World Vision part, when you look across World Vision in the countries that we work in, 90% of the people that work in a Kenya or Rwanda or Somalia or Honduras will be from those countries. Then, as you look across World Vision, you'll see that we've grown leaders up so that, a Kenyan leads our global operations director, Pauline Nkumu, not only a Kenyan, but a woman leader. The head of all of World Vision's operations, so whether it's child protection or economic development or water, started his career as a Malian, as an engineer in a village. He went back to school as part of that process, and now he's in London leading our global programs. So that's really, as an American, to see that World Vision is whatever is local. That's what World Vision really is. It's not. There's World Vision US, but there's World Vision in all the countries that we work in, and led by local leadership. Now, in communities, that's the secret to sustainability. You have to have community ownership, and the water sector is guilty, of having a high level of water points that no longer function. We do know that World Vision is different. Independent study done by the UNC Water Institute, independently funded by the Hilton Foundation, showed that there's a difference in sustainability, and it goes back to this community ownership that we focus on. We've learned to get better at it. So it's not only using existing local leaders, but building up new leaders in that community. And we can do that because of our sustained presence and because of research that we did fund with UNC that showed us really the secret to a sustainable water committee is to have women in leadership positions. And they may not be natural leaders as far in the formal sense, but coming alongside them and teaching women how to give voice appropriately so that they feel empowered to do that is a critical part of our work to ensure that water points are sustained.
I think and I feel very lucky to have started this organization at the period of time that we did, around 2015. There had been an extraordinary amount of literature and research and just general renewed awareness about the progress and also the ills of international development. And really, I am constantly re-inspired by speaking with people like you and at organizations that take the hard look at existing impact and current impact and future impact and make the decisions that, listen, even if we are to proceed slowly, we are going to do so in a community-based generative manner. And that is all to say that I seek to emulate that core philosophy, doing this work with Eco Soap Bank in finding the local leaders around the world who could perhaps execute our program of recycling soap and getting it into the hands of people who need it, and to partners such as World Vision as well. So that's all to say thank you for your diligent work, and let us continue that trend.
Yeah, it's not easy. When I first joined World Vision, I hadn't yet fully appreciated the amount of time it takes. And as a private sector P&G guy, I thought, well, 15 years, how come we can't do this in 3 years? But I came alongside some of our leaders. In fact, one of our leaders, Dr. Emmanuel Apong, who's a Ghanaian that now leads our WASH program in Southern Africa, he held my hand and showed me how we have to come alongside communities for a long time. And he actually is the guy who developed our community development model. He was originally trained as a nurse, and we had problems with sustainability of our water points in Ghana in the 1980s. And he went and he calls himself a village boy. He learned from the community what was needed for sustainability. Of course, over the years, we've improved that model, but we learned it from a local African who is now a great part of our program leading our work in Southern Africa.
I think it's really hard to conceptualize the breadth of World Vision's impact and community integration. How many countries is World Vision currently in? And particularly, you guys are in geographies at a moment's notice. I notice you guys have extensive work in Afghanistan and other geographies as well that sometimes don't always make the forefront of impact reports and things like that. Can you speak to kind of the footprint and the breadth of the impact to date?
Yeah. So as a person who was from the outside, working for the largest consumer products company in the world to move to the largest Christian relief and development organization in the world. I'm used to working at scale, but it is amazing the presence that World Vision has in the most fragile communities. And when you go and see the work, you got to be prepared for very long distance travels into the most rural places. So I'm glad you mentioned Afghanistan. We have an extremely strong program. Our local WASH leader there, Roseanne Kearns, she's moving on now, but she built that program up. We are now the largest non-governmental provider of clean water in Afghanistan. We've brought in and helped sort of challenge cultural norms by having women WASH engineers in Afghanistan. So we're having a really lasting impact just with the way we're staffing the program there. And it's a very, very strong program. We're in about 100 countries, but for WASH specifically, because, World Vision does whatever is needed to address poverty. But for the WASH program, we've developed a business plan approach, ensuring that we reach sustainably the toughest to reach places with sustainable water sources. And we do something a bit different. The business plan guarantees our countries funding with an agreement that they're going to reach a certain number of people in these hardest to reach places sustainably. And that's allowed us to get much more efficient in and have a much greater scale. So much so that for the first time, we were able to take an entire country and put together the plan of what's it going to take within a 5-year period to reach everybody everywhere we work in an entire country. And that's Rwanda. We picked Rwanda for a number of reasons. It means reaching 1 million people because we're the largest providers of non-profit providers of clean water there. But the government has been extremely progressive in working with us, very committed to providing clean water for their country. It was also extremely impactful for our U.S. donors. The biggest hurdle to people investing in international development is they think it's going to be a never-ending stream of having to provide funds and not really seeing an impact. Maybe doing that out of diligence, or maybe hearing, that how tough the situation is, feeling a need to try to help. But we're going to be able to finish the job in Rwanda. For us to do this, we have to raise $30 million from the U.S. And it'll be combined with other funds we get from the Rwandan government and others. So it's going to take a total of $50 million. We're down to we announced it a little over 2 years ago. We're down to a gap in funding of just 3.8 million. So from 30 million needed to just 3.8 million, because people are excited about the fact that we are going to finish the job in Rwanda and reach everybody everywhere we work.
Because sustainability is part of the objective, right? It's not a Band-Aid approach. It's not just a singular intervention. It's a sustainable solution. And that's one of the core tenets of these sorts of conversations, and what I think we resonate with as well. Listen, if you will, we would be fascinated to learn what those high-level conversations look like with donors, with partners, with governments. Well, it's very easy to get stuck in the weeds during these discussions and perhaps negotiations. But in your mind, philosophically, how do you approach those sorts of collaborations? What are the most important points that you try to convey so that everybody's on the same page and that we have a singular goal that you're trying to reach?
Well, yes, shared mission. I mean, to continue with the Rwanda example, I was on the phone with Rwanda right before this call with our national director and getting an update on how we're doing there. when there's a particularly when there's a strong local government, some places that's not the case. We're working in failed nations, so it's not always the case, but typically there is. And more with government signing up to Sustainable Development Goals, they are putting a priority on providing clean water, sanitation, hygiene for their country. That's certainly the case in Rwanda. And so we work within the government system, not only at the national level, but World Vision has a great strength at working to help build the capability of the local government. And that's the secret to sustainability, is having citizens empowered to work and give voice to the local government, even as they elect those leaders. And so in Rwanda, we've learned their process about how it works to provide clean water. The mayors put together the plan, and they do it on a yearly basis. And so we've learned to work within their system. So when they're going to make commitments, we can come alongside them and say, here's what we can do. Can we join with you? That's been good for us as well, because now in Rwanda, as part of our plan to finish the job, 40% of the water systems that we're providing to provide people with water near their homes is funded by the local government. So it's been a success for us, and it's been a success for the Rwandan government. It's certainly been a success for the Rwandan people. Now, we've been able to double the number of people we've reached in the last year because of that collaboration.
If you want to go quickly, go alone. You want to go far, go together. And this is something that we are learning ourselves. We're a small organization, of course. However, we are fundamentally learning day by day that if we want people to buy into the concept of proper hand washing and hygiene, it needs to be done directly in collaboration with the Ministry of Health, the Ministry of Education, such that there is sufficient investment and there is sufficient acknowledgement about the life-saving power of hygiene and hand washing. I would love to transition to that topic, if that's okay. Do you have an example, before we get into COVID relief strategies and progress to date, do you have an example of your first interaction or a powerful interaction of hygiene and its particular value in a community that you've witnessed?
Yeah, so it won't be the first, because it actually, when I built the program at Procter & Gamble for safe drinking water, we had the leading soap brand in a lot of countries. And so I learned what they were doing to create habit change, create a marketplace for soap.
Yeah. And
so I learned that early on in Pakistan and the Philippines, and reapplied it for safe drinking water. And now in the World Vision side, we're reapplying some of those lessons that we learned. And one of the things that we learned about hand washing is that one of the most effective ways, just like we did when I was at P&G, is to teach children when they're young, to have school programs, to educate kids on the importance of washing their hands, and goes further than that, using the latrine and wearing sandals when you go to the latrine and storing your water safely. But the hand washing aspect, to make it so that you reach kids when they're young, and they teach their siblings, even siblings that are younger, they teach their parents. But to make those programs really effective, it's not only education, but you have to make them fun. And so there's songs and skits. But at World Vision, we've gone even further. What's a higher thing than fun? It's
Sesame
love.
Street.
Exactly. And so, the largest clean water provider, a non-governmental provider of clean water on the planet, World Vision, has teamed up with the largest informal educator of kids on the planet, Sesame Street. And Sesame Street not only makes it fun, but kids love the Muppets. Yeah. And so we've teamed up with Sesame Street. We're in 14 countries. There's a Muppet that's specifically designed to teach about hand washing and safe water and latrines, and her name is Raya, and she's brought along Elmo. And seeing that work when we first started it in Zambia, and seeing how proud the children were to show me that they knew how to wash their hands, that's something that's really stuck with me. And to see how they went home and taught their parents the importance of washing their hands.
That's the concept of generative that we are going for collectively. My colleague Frank always tells me we want generative sustainable change, and I never really knew what the concept meant. But it means that we want to create generational change here. We want to instill healthy habits at an early age, such that when people grow to maturity, they make those purchasing decisions themselves, but also pass on those core concepts of hygiene. Here in the West, where did we really learn the core tenets of hygiene? It must have been through our parents. I can't really remember through my upbringing, or perhaps yours, learning it in schools. So perhaps this school-based approach is actually quite more progressive and can actually accelerate that habit formation as well. And so I really admire that approach, sir. I want to talk about your awareness and kind of assessment with regards to barriers towards hygiene. It's very important to constantly take the approach and to reiterate that there's three distinct legs to the wash solution. It's clean water, of course. It's sanitation, which is sewage and bathrooms, and having it accessible and equitable, which is an important concept. And then there's hygiene as well. For the latter, for hygiene, what's your current assessment as to barriers for usage and maybe accessibility?
So, there's a huge problem here. Just like with the global water crisis, and even bigger challenges. We're 3 billion people on the planet that don't have access to hand washing at home. Last week, UNICEF and the World Health Organization, their joint monitoring program, put out a report on the status of hand washing, sanitation, hygiene in schools.
Yeah.
And that report showed that in the countries like where World Vision works, the most vulnerable countries, half of schools don't have water on premises. Of course, it's difficult to wash your hands if there is no water.
Yeah.
And the situation with hand washing was even worse. 818 million children go to school where there's no way for them to wash their hands with soap and water. So it's a huge barrier. We've even had a bit of a barrier talking about it to our donors in the U.S.
Really?
And so, people get the need for water. It's easier to explain. It's easier for people to feel passionate about it. Something as simple as washing your hands and the real need for that to save lives has been a bigger barrier. I hope that COVID has changed that. That's maybe one of the silver linings in this horrible pandemic, is that, everybody does understand the importance of washing your hands to prevent the spread of deadly infectious diseases. And it's not only COVID, it's cholera, it's dysentery, it's Ebola. And so the habit change that we hope will be spurred will last long past this pandemic. And we're seeing some very specific silver linings. We're providing massive amount of hand washing supplies because of our Gift in Kind programs with companies that are helping us, with governments that are funding the work. Since the pandemic started, we've provided hand washing supplies that are in the multiple millions now, establishing mobile hand washing stations in public places that we didn't do before, and even permanent hand washing stations. I hate to come back to Rwanda, but it's fresh in my mind because of my call this morning. The government has asked us to provide hand washing stations in hospitals. We've reached all the hospitals that didn't, and now we're branching out, and all the healthcare centers, looks like we're gonna be providing them in complete coverage in 10 of the 30 districts in Rwanda, which is gonna have a long-lasting impact past the pandemic. So I'm hopeful that this pandemic will take us to a new level of responding with hand washing, and people getting the excitement that they've had about any of the global water crisis. I heard something that I've never heard before on the call this morning. If you'll let me one more example.
Of course.
So Rwanda, like many countries in Africa, shut down quickly. they're used to dealing with deadly infectious disease outbreaks. And so, they've had Ebola in part of the nation. They've had cholera outbreaks. And so they shut down. There's still a little bit of last weekend, some peaks. And so they're shut down more strategically precise shutdown areas. But they've had churches that were shut down. But because we've been asked to provide hand washing stations in 250 churches, those churches are now going to be able to reopen. So I've never heard of the fact that providing clean water, our wash work, is going to allow houses of worship to reopen. And that's pretty exciting.
Oh, absolutely. It's a core component. I'm really glad that you mentioned that COVID is not the only ailment that we're trying to stave off here. From our position, of course, we've been advocating fully and consistently about the importance of hand washing, but it extends to so many other preventative communicable diseases as well that are equally deadly and lethal. That could be easily prevented with the simple provision of soap and water. And so I'm really glad that you mentioned that while this moment does constitute a peak in awareness, it must extend and it must last through the ages. And to piggyback on your observation with the churches, in discussing with our local leadership as well, we are finding that there's an increased awareness on the local level and demand for hand washing now, demand for public hand washing facilities, demand on behalf of schools and line ministries as well for the provision of soap and water such that they can open safely once again. However, and I'm constantly, it's how I'm hardwired, I'm constantly thinking back towards the barriers of how you're going to address this significant and monumental need for product. And I can't help but think that if we want to adopt a sustainable, locally driven solution, it must come from soap that has been created in country or at least regionally such that we can stimulate that economy, that industry, and also get it to the people that need it as well. So I do see a silver lining as well for this. And I just hope that we can meet the demand and solve this issue in the long term. Any thoughts on that?
Well, I think it's clearly product, and it's having the product in the right place and affordable. But it is also the demand creation. And, we have a sort of a three-pronged approach that we're using to address the pandemic, but also to create this demand longer term. And one of those prongs is our school program that we've already talked about, like with Sesame Street. That's hampered right now because of the school closures. But the other two were most instrumental in dealing with the Ebola outbreaks in West Africa. Okay. And those two prongs were working with community health volunteers through the health centers that we do so much work in, and working with faith leaders, regardless of their faith. Because we're a faith-based group, we can work with faith leaders, we think uniquely, regardless of their specific faith. And they are trusted in these local communities. And so what their congregations hear from those leaders, they will trust and do. And so we use this in dealing community health workers along with faith leaders in responding to Ebola. After that outbreak was brought down, Johns Hopkins went in and studied the approach that we used and found that it was effective. And because of the trust that we have, because of the trust in these faith leaders, it reduced the spread of Ebola, and it saved lives. And that was published in Lancet. And so now we're ramping up that same approach, but on a massive scale across 70 countries. We have 220,000 community health workers and 91,000 faith leaders. And they're going out in a massive way and reaching tens of millions of people with hand washing messages to prevent the spread of this virus. And as you said, Samir, it's not just for now, it's for the next infectious disease outbreak that's going to happen as well.
Of course, and the consistent chronic diseases that we've been battling through the provision of WASH in general. And I want people to really understand and internalize it is tens of millions of people that these influential leaders, faith leaders, of course, but also community health volunteers and workers, which are people of that community that have been nominated to serve as a health liaison and health monitor in their own community and villages. It's a powerful structure. It's a decentralized grassroots approach to public health. And it is certainly one that I commend and admire as a way to both express hygiene messaging, but also perhaps get product to people that need it as well. Now, thank you so much for your time. This has been incredibly illuminating and informative. I want to ask, lastly, of course, what still needs to be done here? The pandemic is still persistent. What would you like seen done? And perhaps it's multilateral, not just only from World Vision, perhaps also from governments and other partners as well. What do you think needs to happen here?
So there is so much that needs to get done, but I think focusing on something that is achievable, that you have a clear plan for, that you have the expertise to know how to do it. And one of those areas for us and the sector in general is to making sure that the healthcare centers have comprehensive WASH. And there's a great need for this. So as we look at the areas where World Vision works, now only half of healthcare facilities have water on premises.
Wow.
But get this, only 84% have basic hand washing with soap and water. Only 84%. So, or sorry, 80% lack it. 84% lack having basic hand washing facilities, soap and water. So 16% have it. That's, in the time of infectious disease, of COVID or any other outbreak, not having a way for doctors and nurses to wash their hands between seeing patients is going to cause a lot of deaths. And we know in Ebola that healthcare workers were 100 times more likely to die. And so UNICEF and WHO have put out a global call to action to provide WASH in healthcare facilities. I was on the steering committee of WHO and UNICEF to put out that call to action. And we're thrilled that there were more than 100 commitments that were made. World Vision's commitment was to reach 800 rural healthcare facilities with comprehensive water on premises, hand washing stations everywhere patients are seen, training of healthcare personnel on how to prevent, how to use disinfection protocols to prevent the spread of disease, incinerators, handling of infectious waste. We made a commitment to do 800 of these, reaching 7.2 million people. We're now 18 months into that commitment, and we've reached 84%, 672 of them. So this is an area where, like finishing the job in Rwanda, it's within our grasp, and we hope to make sure that every healthcare center has a way for doctors and nurses to protect themselves and their patients.
Wow. I have goosebumps right now, not only by the extent of your impact and progress, but how much more we still need to go. And please, sir, we are always available for you. If you deem there's any potential for collaboration as well, let us help you guys in executing your goals and your strategies as well. The need is astronomical, and I just cannot believe there are places in this world as sensitive as healthcare settings that do not have a methodology whereby patients and the physicians and the providers can keep themselves healthy in such a vulnerable global situation. So thank you for what you do, and let's see if we can take it further. Now we're going to transition to questions, of which I believe there are several. If you can stick with us a little while longer, Frank, my colleague, will ask a few questions from the audience.
Hello, everyone. So we've got one here, I think, for both of you. Have you approached partnership with for-profit organizations to help solve humanitarian problems outside only asking for donations? For example, you may have access to a country where a for-profit company wants to donate medication. Would you consider partnering to bring their donation to the country?
That is best answered by Dr. Allgood, of course.
Yeah, so I'm from the private sector originally, 27 years with Procter and Gamble, and both Procter and Gamble and World Vision are still each other's largest partner on that side. We provide a lot of the P&G water purification packets, but I'd like to also point out another partnership that we have, and that's I briefly mentioned is with Grundfos and these solar powered mechanized systems that we're able to provide. It's become a major part of what we do. And Grundfos has allowed us to bring in new technology to make our work even better. And one of the things that they have helped us with is with something called the Grundfos AQ Tap Water ATM. It's a rather long name, but what it is a way to make automatic payments at a water kiosk with a little water payment card. And we've brought in the local cell phone companies as well so that you can load credits from your mobile phone. We have found this has had a phenomenal impact on making sure that water collection fees are paid. We provide through philanthropy the water source, the water kiosks, the pipelines, the wells. But then for ongoing operation and maintenance, it's critical that there's local fees that are collected. And I like to call this the mother-in-law effect. Like if there's, before the automated kiosk with the payment cards, there's a water attendant that has to be there. It has to open it, so it's not open 24/7. A kiosk that's automated is open 24/7. But when that attendant's there and the mother-in-law comes, maybe you don't charge her, right? And so now everyone pays a fair and equitable fee, unless they're the most vulnerable in the community, and then that community decides who should have free credits loaded on their card so they can get it. So new technologies, making our work more efficient, is something that we gain by working with the private sector.
And I want to piggyback on that question. Whenever the concept of microeconomics and payments and co-investment comes up in these sorts of conversations, I do believe many donors and many supporters have the immediate reaction, these are impoverished people that we're trying to support. Why are we requiring financial sustainability and payments for such assistance and humanitarian relief? In your own words, please speak to the fundamental importance of co-investment and having skin in the game in terms of ongoing maintenance and sustainability, as you said.
Yeah, that study that I mentioned that was conducted by the University of North Carolina Water Institute, funded by the Hilton Foundation, the things that broke on whether water points, broke down in a very short amount of time, were no longer functioning, or lasted for a very long time, more than 20 years, very high rates of sustainability in the World Vision programs. The key thing was having a water committee that was charging a small affordable fee. So this fee collection is absolutely critical to sustainability. And we did additional work that showed, some communities are in such impoverished, deep poverty that the fee collection may not be standard. So it's not necessarily a standardized fee, but a fee collection system. So in some communities, that meant organizing a day of labor in a large farm, so that there was fees to pay for the operations and maintenance. It may be trading in a chicken to pay for your fee collection system. In fact, we sort of titled the publication that came out of that "Chickens for Water." So and so what underlines that is the community buy-in, that they need to do whatever it takes to keep that water point so that it continues to function long term.
It's context-based, right? It's whatever the local community can do to establish some value and ownership of the intervention. I fully subscribe to this philosophy, and I want to just thank you guys for doing it in such a locally informed manner as well. Frank, any other further questions?
We do, actually. We have a whole list here. Let's see, I'll put this one to both of you as well. How do you decide what countries to go into to help?
I'll just answer very quickly. For us, and it's a bit of a volley to Dr. Allgood. For us, it's based on trust as well. the need for wash, the need for hygiene is monumental. 3 billion people, as Dr. Allgood said, don't have access to domestic hand washing and maybe improved sanitation as well. And therefore, the need is massive. However, it comes down to the trust that you have in your local leadership and the ability for them to co-invest and to execute the mission as well through partnerships with the government and any other essential stakeholders as well. Is that your general observation, Dr. Allgood? Is there more of a baseline monitoring that has to occur as well?
Yes, and so, I mean, exactly, our approach is exactly like yours. I would say that, because we're 70 years old and have been blessed to grow over the years, now we're in most countries. We have put a focus on the most fragile, the ones with the toughest to reach places where other people may not be working. And frequently we've gone into the country because of a disaster. So whether it's Ethiopia during the 80s famine or Somalia more recently, we've gone in more of the emergency relief work. For example, last 6 months, we reached 1 million people with emergency clean water and a million more as well with sustained water sources. But then working with stakeholders to see where's the need that's not being met. What are the communities that really want to have us there? And that's part of that 15-year process. You don't just go in and bring the drilling rig in by any means. For us, that usually doesn't happen until about year 3 of working with the community to make sure that there's that local ownership.
No, that's such an important concept. It's ensuring that our presence is warranted and has been pre-approved. It's very easy from our privileged positions to take a global vantage point and to triage where the greatest need is. But however, if no local trust and buy-in has been established, it won't do any good in achieving our goals, right? So I completely agree. Frank, any follow-ons, sir?
Yes, we've got more. We've got one here from Zoom. Young adults are remarkable advocates for educating and imparting awareness to others in unique and inspiring ways. Do you partner with colleges and universities to help drive your mission?
Yes, so the importance of local advocates, local and young advocates who have who basically have the responsibility and the privilege to direct the course of their own futures. Dr. Allgood, to you, sir.
Yeah, so we have a number of academic partnerships with Stanford University to measure impact on Sesame Street, and they've sent out teams to Zambia, Kenya, India. Our largest collaboration is with University of North Carolina Water Institute. I've already mentioned them. I'm an adjunct professor there, and we have the largest monitoring evaluation program that's ever been done to looking at WASH programs. It's given us an enormous amount of learning. Those data sources were critical for the report I mentioned that UNICEF and WHO just put out on schools, the same thing with the healthcare facilities. And when we do that work in country, we not only is UNC involved in sending people to train, but they train local universities and build up their capability as part of this. And we have programs with Drexel University and Desert Research Institute to train our staff, our local staff, to build their capability that can lead to an advanced degrees for them. Every year we put 10% of our roughly 700 WASH professionals through that Drexel DRI training.
Wow.
That includes virtual learning and on the ground training as well.
Wow. I love the upward mobility at the organization as well. I think that's an important aspect of the work. On a small scale, we have seen that firsthand. So we're currently employing 154 women across 10 countries, predominantly in sub-Saharan Africa. And to watch women come through our doors, having faced some sort of previous trauma, perhaps, or just being in a disadvantaged circumstance, excel, change, of course, the narrative of their life from one of survival to one of community champion, and through their craft creating a product that will save lives in their own community. But also learning basic skills such as basic business skills, supply chain management skills, and learning a true vocation to make soap and get it into the hands of people that need it. I've seen that firsthand. I've seen young women prosper and take on new leadership roles inside of our organization. That's one of the things I don't really get the opportunity to share very often, because we're typically caught up in the messaging surrounding our milestones, how many people we've reached sustainably with hygiene and hygiene education. But there is also this sort of untangible female empowerment and female investment aspect to our work, and to yours as well, as I'm hearing, that we should take further pride in, and we should express at every opportunity that we can. So thank you for that as well.
Yeah, the ripple effect that occurs when you provide improved hygiene, sanitation, and water in women is just incredible. And it's clearly health, but it's education for the kids because they're not getting sick. It's the opportunity, in your case specifically, to sell soap, but to do something that brings income into the household, learning social skills, taking on leadership positions, just having time to love your kids. All those are important. But as I've seen it, one of the things that has played out over and over again with me witnessing is the change that occurs in the relationships between a man and a woman. When the woman now is empowered, when she has some income, it's dramatic and pretty consistent. You hear things like, well, now she's contributing to the household. Like she wasn't before, but it just changed that perception. I was with a couple recently and asked them how it had changed their lives. And I didn't even know if they were faith-based, but I asked, and they said, when I was having to gather water and when the kids were sick, from not having hand washing, I wasn't able to go to church, but I love to go to church, and we love to sing in the choir. And so I got to witness them singing together in the church, which was really, their relationship, the relationship with Esperance and Martin had really completely changed because of something as simple as water and hand washing.
Basic dignity, basic dignity. Thank you for sharing that anecdote. For us, this is not to demonize men whatsoever, but there's one statistic that I generally cannot get out of my head, and it's the primary driver by which we invest in employment for women across the globe to make millions of bars of soap, of usable soap for communities in need. And the statistic is that according to the UN Women Commission, women reinvest 90% of their incomes back into their family units, as opposed to 40% for men. And for me, for us, I should say, to take a holistic, sustainable approach to community development starts with women. It starts with women and women's independence in the community, and whatever we can do to further foster that and invest in that factor, I think will make for the long-term changes that we all seek.
That's definitely the case. Strong women equals strong world, right? We've seen that on the ground, and World Vision puts a strong emphasis on that, and have really found receptivity with that concept with our U.S. donors, women, and empowered men who want to be part of that to help give women in the developing world a chance. When you're hauling water, your kids are sick because they don't have a way to wash their hands. Your life is dramatically different. I mean, imagine carrying every single day, usually several trips, 40 pounds of water on your head, and then training your young children to do the same, and knowing that their life that's going to be their lot in life. That's really tragic. It's a burden. It's physically hard, and it makes it hard to get an education, hard to break out of that cycle of poverty. So when we provide people with clean water, we provide them a way to not get sick because they're washing their hands. It really transforms lives, and good development really just starts with that.
Very articulate, extremely eloquent. Sir, we cannot thank you enough for your time. We can appreciate how busy you are in these circumstances. And lastly, on behalf of everyone at our organization and who is here today listening, thank you for your impact, sir. Please don't forget how monumental it is bringing clean water to millions of people through your work in collaboration with your team, of course, but also with partnerships around the world. Thank you for what you do.
Thank you, Samir, for having me. We look forward to doing more work with EcoBank.
We will support you in any way that we can. And thank you all for joining here today.
Thanks. Bye-bye.